Hey, everybody. I am going to cover chapter 4, which is body systems and related conditions. We covered this in our presentations, but of course, we wanted to go a little bit more in depth. Okay. So I will put this into different sections, and hopefully it will be easier for you all to consume throughout your weekend. All right, so homeostasis, what is it? It is just the condition where the body is all working together. All of your levels are correct, everything is functioning, you are in like full homeostasis mode. Metabolism is the way the body just processes food, energy, this everything that is in the body you consume, and then whether you have a high metabolism, the body processes your food really quickly, turns it into energy, puts the sugar where it needs to go, puts the fat where it needs to go, or you have a low metabolism, slow metabolism, and your body consumes the food and it takes a while for things to break down. Okay. Dilate versus constrict. Dilation, dilate means that it's getting bigger, and then constriction means that it's getting smaller. So when we talk about dilate and constrict, I always think about the eyes. So with my pupil, right now I'm in a sunny room. So my pupil is really, really small because I don't need to get all of the light in my eyes. So it's filtering out to see how much light do I need in my eyes. That's it. Now I'm able to see. But if I go into my bedroom is really dark. So my pupils are gonna constrict. No, my pupils are gonna dilate. I had that backwards. Did I say that backwards? All right, I'm not gonna pause it. So right now, I'm in a sunny room. My pupils are gonna be really small and they're constricted because they are smaller. If I go into my bedroom is really, really dark. Or if it's nighttime, and we go outside, then your pupils are gonna get really bigger. It's trying to find the light somewhere in the room, somewhere outside, so you will be able to see. Um, so dilate gets bigger, constriction gets smaller. I think I had that mixed up. Dilation, bigger, constriction, smaller. And your pupils do it, but also your blood vessels do it. Your blood vessels dilate and then they constrict. So we will talk about that when we get to the circulatory system. One of the things that happens is like your blood pressure. So we'll get to that in a minute. All right. So we have talked about this the couple of weeks that we've been here. Signs. So our signs are objective. This is signs versus symptoms. Our signs are objective, so it's what a nursing assistant sees, hears, feels, and smells, not tastes. So if I see you and you're slumped over, if I hear you and you have slurred speech, if I feel you and you have a fever or you're warm, certain parts of your body, and if I smell you, might smell your body odor. I might smell poop or pee. I might smell like sweet, a fruity or maple like breath. That might be a sign for diabetes. So signs are what you can have with use or gather with your senses. Symptoms. Symptoms are what the resident is reporting to you. So symptoms are um, pain, feeling uncomfortable, stomach is hurting, um, feeling kind of loopy, you can't really say this is subjective. So if somebody grimaces every time you touch them, you see the grimace. So you are seeing a sign, and then you ask them, what is your pain scale from 1 to 10? And they say it's a 10, or they say it is a 3, but you see them grimace every single time. So those are the symptoms versus the signs. So we always look for both the signs and the symptoms. Okay. So these are anatomical terms about location of the body. So we, if you hear another medical professional or healthcare professional talk about they have a rash or they have a mole on the interior part of their body, and they don't have anything, their posterior body is clear. Then anterior means front, posterior means back. Okay. So back of the body is posterior, front of the body is anterior. Okay. So that's front and back. Now, if you kind of split me in the middle, we can talk about superior versus inferior. So I always think, if it is like, what is closer to my head? Superior is close towards the head, inferior is away from the head. So if I look at my arm here, okay, which one is superior to the other? My elbow is superior to my wrist. My wrist is inferior. It's going away versus my elbow is closer to the head. Okay. Or my legs. My legs are inferior and my chest is superior. Okay. And then um, medial Medial is towards the midline of the body. This is the midline. Cut me in half. That's the midline of the body versus lateral, that is away from the middle of the body. Medial, middle. Okay. Lateral goes away. Okay. And then proximal and distal. So instead of doing medial, which is middle, cut me in half towards my waist, and proximal is closer to the torso, so closer to this part of my body, and then cut me in half toward at my waist. Distal is further away from the torso. So my toes and my foot, they're all distal to my waist. Um, my hips, maybe are proximal. They're closer to the torso. All right. So I will don't have my workbook with me because I'm at home. Um, but I promised that I would get these to you guys. So I like to keep my word. Um, I will look in your workbook to see if there is a little bit of homework about naming the parts of the body, but I can't um, get them right now because I don't have them. I don't have the book. All right. So let's look at this, the integumentary system. I don't remember who had that one, but this is all about skin. Okay. So some fun facts you probably already know. Skin is the largest organ system in your body. If you think about all of the organs in our body, the heart, the lungs, um, the liver, the pancreas, all of that. Also think about the skin. Okay. This is our largest system in our body. It covers everything else. It is a protector. If it loses water, or it has a fever or something, it's going to try to regulate it. But you will see the signs if you're getting dehydrated, because your skin's going to get really, really dry. Okay. So let's look at what happens if you are getting a little bit older. So once you get a little bit older, your skin starts to get a little bit thinner. Um, it starts to be more fragile. Fragile means that if you hit up against something, you might bruise, or if you hit up against something, your skin might tear because it's thinner than it used to be. Right now, our skin is pretty thick. So if we rub up against something, it just hurts, or we might not even feel it at all. It has less elasticity. So right now, my skin is kind of bouncing back. But an elderly skin, you can probably pick it up and it might stay there for a minute. And sometimes it might bounce back. And sometimes it might just stay until they start moving again. The other thing is that they are going to lose a lot of fats up under their skin. So if you ever are around someone and they keep on asking for a warm blanket, can I get some more socks? Or if it's warm outside and they still have on long sleeve clothes and 3 pairs of underwear, the reason is because they're losing a lot of fatty tissue, and all they have is skin, a little bit of fat, and bones. Um, and we talked about the other day with arthritis. Arthritis really hurts when it's cold outside. So with that, it hurts when it's cold outside, and arthritis is a bone disease. We don't have all of that fat around our bones anymore. You are going to feel the coldness, and it's going to hurt. Their hair is going to get a little bit thinner. They might get wrinkles or brown spots in their skin. Their nails are going to get more brittle, and then their skin really will get a little bit more dry, where you need to use some moisturizer, use some lotion, use some oil with them, and that's going to help for them to, number one, you do still want them to stay hydrated. Number two, it's going to help for them to not have broken skin. Um, if they have moist skin, a lot of moisture instead of a lot of dryness. Okay. All right. So, what can you do to help? All right. So, we kind of talked about already. Use lotion or oil. Um, they don't need to take baths as often because their skin is going to get dry. But if they have, of course, they have body odor, if they have something going on where they have some kind of skin disease or they're itching a lot, they might need to get that bath more often, like twice a day instead of once a day. Um, of course, if you're taking a bath, it's going to dry out your skin, and you make sure that you put the lotion on. Okay, shampoo their hair less frequently. Be gentle with their hair. Be gentle with their skin. Make sure that they have increased fluid intake, and we always do this. Keep the beds wrinkle free. Okay. All right, so what should you do? What should you see? If you ever see anything, what should you do about it? So for skin, if you ever see anything wrong with them, if you see the open sores, if you see discoloration in color, if you see where they're flaking and the skin is flaking and is extremely dry, then you are going to want to let the nurse know, because that is an issue. If you see something open or even like a little bump, even if you think, oh, it's just a hair bump, that's something to watch because it could turn into something a little bit worse than just a hair bump. Okay. So those are things that you can report to the nurse. And the other thing with um, integumentary system, or which is skin, is like different moles. If you see a mole that you hadn't noticed before, let the nurse know and then just watch it, because it could be a sign of skin cancer, which is another issue that happens to everybody. If it's going to happen, it's not just an elderly thing, but it could happen more often to them because they're not really looking in different places, and they see a mole there and then it grows, and it could be skin cancer instead of just a mole that they've had all their life. Pressure ulcers are where the pressure is in the bed. If they are always laying flat on the bed, then the pressure is going to be on their back. It is probably going to be on their shoulder blades. It might be on their backside. It might be right at the spine. Those things look really bad and they hurt. And it takes forever for them to heal. So that's why we don't like to keep the bed-bound residents on their back the entire time. We would like to turn them every 2 hours. And if you get the answer on any kind of test, it's every 2 hours unless otherwise ordered. Okay. All right. So, scabies. Have y'all heard about scabies before? Scabies is skin lice. Yeah, skin lice. It's not really like lice in your, it is like lice in your hair. Lice in your hair um will grab on, and it likes to be around the back, the neck of the hair, but there are eggs and live mites that just go around, and it's contagious, right? Scabies, the skin, is skin lice. So with the skin lice, it is actually on the skin. I've never seen it crawling. I've only seen somebody have it, but I've never actually seen the mite itself. So what happens is if you see somebody, this is skin lice is also super contagious. If you see somebody like itching, they're just itching really, really bad. It's making me itch. That's why I just keep on itching right now. They're really, really itching really bad. And you might see some streaks of like lines. You might think, oh, is it because they're itching and they scratch themselves that hard? It might not be that. It might be the actual scabies mite that goes up under their skin and lays eggs, and it causes a rash that looks like streaks up under their skin. Okay, so it is contagious. If you ever encounter something like that, you gather all of their clothes and put them in a big baggie. They can have that until it gets treated, and then they're going to take a medicated bath. So it's a regular bath with medication. Wash their hair, wash their whole body, get into all of the crevices, and then get them some clean, fresh clothes, clean, fresh linen after we clean everything up, and then they should be good to go. After they're medicated, their body is medicated, and then they're going to be on like some antibiotics, then they are safe to be around. They're not contagious anymore. And then with the set of clothes, it has to get treated also. Okay. So this happens a lot in prisons, homeless shelters, and guess what? It doesn't happen a lot in the hospitals, but it does happen a lot in the nursing home. Okay. All right. So that was chapter 4, section 1, which was integumentary. I am gonna pause it and then I'll get back with you on um musculoskeletal.